The San Francisco Department of Public Health gave an update today on the state of overdose deaths in the city.
They say getting better, down slightly from 67 deaths in January to 64 drug-related overdose deaths last month. Ground 4's Rob Nesbitt joins us live in the newsroom now with the treatment methods that, Rob, they say seem to be working at least a little.
We've talked a lot the last year about the opioid epidemic and fentanyl's role in it. Fentanyl is still the leading cause of overdose deaths in San Francisco, and health experts talked at length today about how contingency management makes a difference. After updating the overdose numbers for the month of February, the Director of Behavioral Health Services at the San Francisco Department of Public Health, Dr. Hillary Cunnins, talked about the importance of medications like methadone to treat opioid use disorder. The majority of Tuesday's update, though, was used to talk about contingency management.
Contingency management is a behavioral therapy that can help people stop using stimulants such as methamphetamine and cocaine and get in and stay in treatment.
Contingency management on paper uses motivational incentives to help people kick their addictions. It's being used in 24 California counties, according to Mary Silla with the National Harm Reduction Coalition.
We're giving folks money if they're able to withhold their drug use and hope to get them onto a course of treatment.
Not on the list of drugs Tuesday was fentanyl, but Dr. Cunnins says while the majority of overdose deaths are driven by fentanyl, they often involve other drugs that contingency management is used for.
So by reaching people who use stimulants and helping them to stabilize their lives, we expect that we will see some positive health outcomes for all of their substance use.
Though overdose numbers month to month are down in San Francisco, there were 12 more overdose deaths in February compared to the same time last year. It's why the Department of Health says it's using high-impact interventions to save lives.
Even though addiction is a chronic illness, recovery is possible. There is a way out of addiction and into a healthier life.
The Department of Health says it's focusing most of its resources towards communities with high rates of overdose, such as unhoused people and those who have had a prior overdose. Reporting in the newsroom, I'm Rob Nesbitt, Ground 4 News.